Welcome to Health Matters, brought to you by the Office of Correctional Medicine at Southern Illinois University School of Medicine. My name is Brian, and I am a pharmacist. Today, I will be telling you about a vaccine that protects you from Hepatitis A and Hepatitis B. There is a single vaccine called Twinrix that protects you from both of these serious diseases. In this video, you will learn what these diseases are, how they spread, and how to keep yourself and others safe. This video is for informational and educational purposes only. It is not intended as medical advice and should not replace consultation with qualified healthcare professional. Always seek the guidance of your doctor or other licensed medical provider regarding any question you may have about your health or a medical condition. Hepatitis means the liver is swollen or irritated. The liver is a vital organ that handles hundreds of key jobs. It acts like a filter to clean your blood and break down things like alcohol and drugs. When the liver is swollen, it has a much harder time doing these jobs. Hepatitis can happen from certain medicines, health conditions, or drinking too much alcohol. Most of the time, though, it is caused by a virus. Two of the most common types are Hepatitis A and Hepatitis B. Hepatitis A is a virus that spreads easily from person to person. Not everyone who gets it will feel sick, but some people can feel very sick for weeks or months. Most people recover completely. In rare cases, the virus can cause permanent liver damage, liver failure, or death. Common symptoms include fever and tiredness, upset stomach and stomach pain, loss of appetite, dark urine or light-colored stool, yellow skin or eyes, also called jaundice, and joint pain. The Hepatitis A virus is found in the stool and blood of a person infected with the virus. It spreads when tiny amounts of stool from an infected person gets into food, drinks, or onto surfaces. It can also spread through poor hand washing, sharing items, or close contact with someone who is sick. Anyone who hasn't had the virus or the vaccine can get Hepatitis A. People living close together, like in correctional facilities, have a higher risk of getting and spreading the virus. Others at higher risk include people who use drugs, men who have sex with men, and people with conditions like chronic liver disease or HIV. Hepatitis B is also a liver infection caused by the Hepatitis B virus. While some people get better, others develop a lifelong infection. Over time, Hepatitis B can cause liver damage, liver cancers, and liver failure. The symptoms are very similar to Hepatitis A. Some people do not feel sick at first, but they can still pass the virus to others before any symptoms show up. Hepatitis B can spread through infected blood or body fluids. It can spread by sharing needles, razors, or toothbrushes, or by having unprotected sex. It can also be passed from an infected mother to her baby at birth. It does not spread through casual contact like hugging or sharing drinks. The risk is higher for people who inject drugs or have unprotected sex. Others at risk include people on dialysis, people with conditions like diabetes or HIV, men who have sex with men, and pregnant women. The best way to protect yourself from Hepatitis A and Hepatitis B is by choosing to get the vaccine. They are different diseases, but the Twinrix vaccine is available to protect you from both. Health experts, like the Centers for Disease Control and Prevention and the Illinois Department of Public Health, recommend this vaccine for all adults at risk. This includes anyone living in a correctional facility. 3 doses of the vaccine are needed over 6 months. You must get all 3 shots to get full, long-term protection. Staying healthy means you won't have to miss out on work, classes, programs, or visits because you are sick. Besides the vaccine, you can lower your risk with good hygiene. Wash your hands often, especially after using the bathroom and before eating. Never share razors, needles, toothbrushes, or tattoo equipment. Thank you for accessing this video on Hepatitis A and Hepatitis B vaccination and taking time to care for your health. Remember, vaccination is your choice. If you have any questions or concerns regarding this vaccine or any other healthcare concern, please contact your healthcare professional. To learn more about upcoming vaccine clinics from the Southern Illinois University Office of Correctional Medicine, you can sign up on your tablet or send a request to Healthcare. The Office of Correctional Medicine at Southern Illinois University School of Medicine invites you to explore more educational content in our Health Matters series.